Oh, excuse me. Senator Cortez Masto, I apologize to my colleague, is next. Senator, are you out there?
I am here. Thank you.
Wonderful.
Thank
It
you,
is your
Mr. Chair.
time.
Thank you so much for holding this hearing. It is such an important topic that we need to address. I'm so pleased that the Senate Finance Committee is really working on addressing mental health. I am pleased to be able to join my colleague, Senator Cornyn, in co-chairing the subcommittee on increasing integration, coordination, and access to mental health. Let me start with Mr. Williams. We've established that Medicare coverage issues persist among seniors just as they do among families. And if you believe the old adage that as goes Medicare, so goes the market, then the mental health coverage gaps in Medicare have consequences for private coverage too. So, Mr. Williams, let me ask you this. If there was better Medicare coverage of mental health, could we reasonably expect better commercial coverage as well?
Thank you for that question, Senator. Yes, I believe very much so that Medicare sets a benchmark. I started my career focused on Medicare policy. And in doing so, working at the National Academy of Social Insurance, I learned that through Medicare policy, the rest of healthcare policy goes. We've seen that consistently with the Medicare Modernization Act, with several balanced budget acts, through the Affordable Care Act. When we use the leverage of the Medicare program, it affects change throughout all of the healthcare system. And we have that opportunity to do and make that same change with behavioral health, which includes both mental health and substance use services. And a vital way in which that can be done is through the expansion of peer support. Certified and trained accredited peer support specialists have been able to help individuals achieve recovery goals and do it in a cost-effective way. And so if Medicare were to expand coverage of that type of provider, that benefit would, one, be available to Medicare beneficiaries, but it would also set the precedent that would be an area of focus and opportunity for the commercial sector. And so, yes, an action in Medicare is great for Medicare beneficiaries. It meets their needs, but it also is the beginning of a chain of change that ultimately will impact the entire healthcare system. Thank you.
Mr. Williams, thank you. And that's why this conversation is so important. And I was pleased to be able to introduce legislation around peer-to-peer counseling programs. So pleased that Senator Daines joined me and we were able to get it passed because we've seen the benefits of really putting in place action around addressing mental health and doing something about it. And the conversations we're having are so important. But let me ask Dr. Keller this because a couple of witnesses have talked about mental health crisis services in the context of parity in Medicare. If you get into a car accident, a paramedic trained in emergency medicine takes you in an ambulance to an emergency room where you're going to be cared for by a physician. You might be admitted a few days, then sent on your way with follow-up instructions. But if you're experiencing a mental health crisis, the ambulance cannot take you to a crisis center. Medicare won't pay for the health providers that are best equipped to treat you in that moment, people like peers or licensed counselors, and they won't pay for your nights in a stabilization facility. They won't pay for the community health worker that helps to set you up with a counselor for ongoing care. So, Dr. Keller, if we're to achieve parity in Medicare, do we need to expand coverage of the crisis services as well?
Well, Senator, thank you for that question, and thank you for your leadership on this in partnership with Senator Cornyn on Senate Bill 1902, which would extend that to Medicare. And it's essential because for exactly the reasons you said, and that really begins at the moment when the person shows up, because not only will Medicare not cover the crisis care, it won't pay for the cahoots person that might be coming to help you with your mental health care or the right care person. We need to have the Medicare coverage kick in just like Medicaid does now, just like some commercial insurance does now, at the point of crisis all the way through to the transport and to get the person to the stabilization unit and to cover the full array of crisis services, which do include peers as well as essential providers within that network. And I think it's important on the Medicare side. It is also important on the commercial side. So I think parity across Medicaid, Medicare, and commercial payers in this area, and your bill, I believe, does that, and I think we strongly support that.
And thank you. And I have to thank Senator Cornyn and his staff. They've been great partners on this legislation. Clearly, we need the parity. We need the integration for the very reasons that we were talking about today. Thank you, Mr. Chairman.
Thank you, Senator Cortez Masto, and thank you for all your help in the CAHOOTS effort, particularly the focus on bringing together law enforcement and mental health folks. Your leadership on that was especially valuable. All right, but now we have Senator Hassan, our colleague from New Hampshire.
Thank you so much, Mr. Chair, and thanks to you and the ranking